Over 800 coronavirus cases have been reported at the University of Georgia, but the administration is full steam ahead with in-person learning. NBC News correspondent Ellison Barber joins me now. Ellison, how worried are faculty members on campus? How are they feeling?
They're very worried. I mean, look, this is all a big experiment. And regardless of what administrator we talk to, we've talked to a lot who just anecdotally kind of across the country who will say they are in favor of bringing students back on campus and having in-person classes. But they have acknowledged that this is not riskless. At the University of Georgia, they have seen their cases go up and their percent positive of cases went from 2% to 5% in just 1 week. And there's a chance, there's concern, particularly among faculty members, that those numbers might not be entirely accurate because there's a lag in time in just getting some results. And then there has also been reports that students there are getting COVID-19 tests off campus, which they're able to do. But when they go take those tests, they're using their parents' insurance and sometimes using their parents' home address. So there's concern that perhaps those cases of positive cases might not be being sent over to be counted in the tally at UGA. Here's some more of what faculty as well as health professionals at UGA are saying.
I have significant concerns because I believe that these numbers are actually quite conservative. It's a time lag, so they're old data at this point.
When students go and get this test done and pay for it with their parents' insurance, is taking the address from the form which attributes the COVID case to their parents' home county, not to Athens-Clarke. So as alarming as the numbers from DPH are today for Athens-Clarke County in the last several days, they should be more alarming.
UGA's president has called that recent jump concerning, and in a statement, he urged students, I'm quoting here, to resist the temptation to organize or attend a large social gathering. He's also asked people who are heading out for Labor Day weekend activities to be extra careful. Savannah?
Ellison, yesterday we talked about another university in a different state, the University of Alabama, with 1,200 cases in just under a month. How many coronavirus cases are too many for colleges and universities?
Yeah, I mean, you've reported on schools reopening as well, so I know you know this, but it is sometimes so difficult to just get numbers from a lot of these colleges that are reopening because there is no standard way that anyone is counting or reporting their numbers. So sometimes it's difficult to just get information from these universities and colleges. And then when it comes to getting kind of what their top line is, if you will, to where they say, okay, enough is enough, let's send students home. I have asked that question to many administrators, and almost every time you never get a concrete answer. They'll say something like, we're going to let the data drive our decisions. We'll monitor the data day by day and reassess. But it's hard to get any clear, concrete number. Just some examples for you. If you look at like a couple different schools to try and anecdotally find the answer, I don't think it's any clearer, but I think it's worth looking at. So University of Alabama has around 33,000 undergraduates. As you said, there are 1,200 students at least who have tested positive for COVID-19. They are continuing with in-person classes as far as we know and have no plans to move things entirely online. University of Georgia has about 30,000 undergraduates, close to 800 students currently positive with COVID-19. Same thing. No plans to change to online learning. They're continuing with in-person classes. But James Madison University, they have 22,000 students and about 600 student cases of COVID-19. But they are now moving everything to online starting on Monday. So JMU has been open about a month longer than UGA and Alabama. They have less cases, but they're making the decision to move to online. UGA and Alabama, they're not. Savannah?
Ellison, I also think it's worth noting that we've now been reporting that 1,200 number at the University of Alabama for a couple days. You pointing out there's 33,000 students, they're still going to classes. That number is likely higher by now, and we just don't know yet. Now let's talk about holiday. You mentioned Labor Day weekend. We're coming up on this long weekend. Obviously, a lot of people looking forward to it. You can imagine what that's going to look like on a college campus. What is the federal guidance for colleges on what to do over this holiday weekend?
Yeah, so Dr. Deborah Birx from the White House Coronavirus Task Force was actually talking about this yesterday. She was in Michigan having a meeting with the governor there, and as she was talking to reporters, she spoke directly to students about Labor Day. Listen here.
To every university student out there, if you have done something that is not so great and so smart, and you've been in a crowd without a mask, you're likely to become infected. Do not go home to your parents or your grandparents over Labor Day weekend and spread the virus to them. And do not go out in your communities without a mask on. For universities where we know children, we know young adults are out and about, they need to really have a testing strategy. Because if you find 200, there could be 2,000 in some of these large universities.
It's interesting, you know, right now you hear a lot of adults in power talking about the need for students to do more, and perhaps rightly so, to not, if they're going out to bars, not go to bars where they can't socially distance, try to limit going out. But one thing that I do think is interesting, when I was talking to one of the professors at the University of Alabama the other day, he told me he felt like there is a bit of a shift in blame being placed on students at colleges and universities that are having these outbreaks, and he felt like that wasn't fair. His argument was that it is unrealistic, in his view, to expect young adults, particularly when they're in a congregated college-like setting, to not socialize when they've been at home for so long, and that the adults in charge should have anticipated that better. In his view, that's why that they shouldn't have been brought back onto campus. But either way, he said he feels like what we're seeing right now is a bit of a shift in blame and putting it more on students. He didn't feel like it's fair, but obviously you're hearing from Dr. Birx as well as other college administrators urging young people, young adults at college, to make sure that they are taking extra precautions to try and curtail some of these outbreaks we've seen.
Definitely something valid to point, Allison, that these students have just been cooped up at home, a lot of them with their families, with their parents, and now they're back at school. You know, how much are we expecting here? Thank you so much for keeping an eye on these important numbers.
You bet.
Miami-Dade, Florida police have arrested a teenager connected to a relentless cyber attack crippling virtual learning for thousands of children in the county. NBC News correspondent Carrie Sanders joins me now. Carrie, teens these days certainly know how to do a lot. What has been revealed about this arrest so far? What do we know?
Well, the authorities were stymied initially. I mean, there's 350,000 students in Miami-Dade County. That's the fourth largest school district in the country, and the kids' virtual learning was shut down. So they began searching what's called the digital footprint, fingerprint. It leaves a little bit of a number behind. The problem is they were overwhelmed by so many digital fingerprints, but they eventually were able to key in on one address. It turned out to be a 16-year-old junior at South Miami High School at around 2:45 in the morning. They moved in, made an arrest, and they say as they approached and talked to him, he did confess to at least 8 attacks on the computer system that had crippled the online virtual learning and exposed the problem that the school, quite frankly, said they did not expect. This is what they had to say just a short time ago at a news conference.
This does not rule out other protagonists, as federal and local law enforcement sources have informed us that in addition to these local attacks originating from the South Florida community, most specifically the one perpetrated by this 16-year-old student, there are other attacks from foreign nations, such as Russia, Ukraine, China, Iraq, and possibly others.
And so the question is, how was it that these attacks were being coordinated around the world? Well, computer experts say that somebody as young as 16 years old could go online and actually pay for what's called a denial of service attack on a specific computer. And so the pings coming from Afghanistan or coming from Iraq or from China may not be people in those countries who are perpetrating this. It may be that the 16-year-old found one person in another country who then arranged for the computers to make the attack. That's kind of what the Computer Crimes Division from the FBI, the Secret Service, as well as the local police are trying to figure out. But realistically, trying to eventually hold somebody accountable overseas, we've seen it before, and it's very difficult to not only track those people down, but then to bring them to justice, Savannah.
Now, Carrie, this must be extremely frustrating for students, teachers, and parents. When are classes going to be able to fully resume?
Well, this is day 4. So on day 4, with the shutdown of these denial of service attacks, the system is beginning to come back up. Some kids still had problems getting into class today, but so much of a different situation and incredibly frustrating because students as well as parents all trying to do this from home. Remember, on one side of the house, you have a child in their room or maybe in the living room with a computer trying to begin class. It's a very new experience to take school from home, especially for somebody like in first grade. And then maybe on the other side of the house, you have the parent who's trying to work from home. And initially, everybody wondered, well, is this got something to do with my internet service or too many computers in the house that are online, too much video streaming? But when they finally realized that they were able to determine that this was a computer failure because of the attack at the school level, then the question became, well, how did teachers communicate with their students at home? Because they're all communicating through this portal. Some teachers, fortunately, were able to get their students outside emails, text messaging numbers, and they said prior to this collapse, they said, look, when we begin school, if we have a problem, I'll let you know by sending you a Zoom or something in Microsoft Team meetings or, something along those lines so that they could bypass it. So some kids did have school, but Savannah, so many people thankful that the system appears to be up and running. But there's still that one problem, which is the denial of service attacks could happen again.
Carrie, you walked us through these issues. I think it was on Monday, the coding issues, now this cyber attack. I think I see an expertise forming here for you. Thank you for telling us about all this.
You learn quite a bit as a reporter, but thank you, Savannah.
I'm serious. You walked us through all that fingerprint and everything. It's complicated. Thanks for telling us.
Okay.
Back to school season is underway, but questions still remain about what that should look like during a pandemic. Dr. James Wood, Assistant Professor of Pediatrics at Indiana University School of Medicine, joins me now. Dr. Wood, we've already seen outbreaks at many schools that have reopened. You led a study about kids and the asymptomatic spread of COVID. What did you find?
Yeah, well, what we found was that kids in our study anyways were actually, it was pretty low in terms of how many kids were infected and the rate of what we call asymptomatic infection. So overall, there was a low number, and that was, of course, not a definitive answer because this was only a small section of the community. But we did find that the overall rate was pretty low. And so we were encouraged, at least, that maybe the number isn't quite as high as maybe once thought.
Now, we know coronavirus affects kids and adults differently. We've heard a lot of different back and forth things about this, things that have ultimately contradicted each other. But with students heading back to school, what symptoms should parents look out for?
Right. Kids are showing, symptoms somewhat similar to adults and somewhat in some ways, in other ways, maybe a little bit different. So kids tend to have low-grade fevers. They probably, or a lot of the times, they will have those body aches that adults have. They may have trouble, though, kind of explaining what that means. And so they may overall just kind of feel fatigued. They might not feel just generally well. Another thing that we've seen in kids, too, though, is GI symptoms. So diarrhea, vomiting, as well as some of the respiratory symptoms similar to adults. But kind of on the whole spectrum, they seem to be a little bit more mild in kids. And so kind of having a high suspicion for that in kids is always, what we're looking out for.
So watching out even for those mild symptoms. Now, Dr. Wood, we had some big vaccine news this week with the CDC telling states to be ready to roll out a vaccine by November 1st. I mean, that's quite soon. Where will kids fall on that rollout schedule?
Right. So as of now, kids' involvement in vaccine studies is pretty low. In general, in a normal vaccine study, kids are sort of on the back end of where things are studied. We need to make sure that vaccines are safe in healthy adults first, and then they go out to be tested in kids. And unfortunately, that is similarly happening with COVID-19 vaccines. As a pediatrician, it does worry me a bit because, kids, it needs to be tested in kids, and for our society to be able to open up and get it to a number of children or a number of people in the society, kids need to be included in those studies. So as of now, there are very few, if any, studies that are enrolling kids. And but hopefully, coming soon. And really, as a pediatrician, my job is to advocate for looking out for kids and to test these vaccines in kids to be sure they're safe.
So without a lot of kids involved in these studies, what are you looking for to know if a vaccine is safe for kids? Can you take the information that you're getting from these anyway and determine if it's safe for them?
Yeah, there's a saying that we have in pediatrics that kids are not just little adults. And unfortunately, it's kind of hard to extrapolate a lot from adult studies. Some of the information that we get will be helpful for sure, but kids tend to act differently, both in terms of infection and in terms of vaccine. So kids' immune systems act differently than adults, the way that they respond, and especially safety signals as well. So I would love to be able to tell you that, yeah, everything that we learn from adults, we'll be able to just, say, yes, the same thing is to be expected in kids. I just, unfortunately, that's usually not the case.
Well, then hopefully we're able to get some of those children into these trials so that we can figure that out. Thank you so much, Dr. Wood.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.